Hello, I'm Bobby Peary, and I'm a patient of Dr. Hal Cates' hip replacement mini-incision. My surgery was in January of 2004, and I have to say that I'm really pleased with the outcome. I had so much pain for maybe 3 or 4 years, and the pain was a different type of pain than what you can explain. Only to those that have any hip problems know what I'm alluding to. It's kind of difficult to explain, but you have a weakness in the hip area, but it's the pain that goes down into the groin. When you're laying at night, the numbness hits you, and that weakness and that throbbing to the point where you have to continually readjust your placement of your body. And boy, you sure don't lay on the side that your hip is bothering you. So after visiting my internist and being on pain pills for a couple of years, it got exceedingly more difficult to walk a straight line. And one day I was in my garden, which I really love my gardening, and that was one reason I held off for so long, is that I couldn't get up from my weeding process. And I laid on my side and weeded around, and finally I got my knees up so I could, but I couldn't put any weight on my one leg. And that was the most helpless, vulnerable feeling after all of these years of being so physically active and physically strong. So it was my good fortune to happen to notice Dr. Cates' advertisement in a magazine and a newspaper concerning his mini-incision. A regular incision for a hip replacement is 12 inches long. My God, I put my hand up and I thought, 12 inches? Yumpin' yiminy, that'll take forever to heal. So the mini-incision is a 3 to 4 inch incision. And I thought, okay, there's definitely advantages to that because the healing time would be much less. There wouldn't be as many ligaments or muscles cut. So I made an appointment to see Dr. Cates. And I was absolutely impressed with the staff. The friendly environment, the concerned environment. The fact that they gave me names and telephone numbers of people that I could call. To receive an understanding, compassionate voice on the other end of the telephone made it so much easier to deal with the recovery time. And I really thank Dr. Cates' staff because they are really compassionate people. Truthfully, I am freer. Getting in and out of a car, I don't need help. Of course, I like to have help with my husband's gentlemanly ways, but I'm an independent individual again, and that makes all the difference for my own sense of worth and the fact that I don't feel as vulnerable. I can hold my head up and say, hey, I'm going to be able to handle today's activities. I can wear high heels again, and I love that feeling.